Hello, everyone, and a very warm welcome to another episode of the Talk Room series of podcasts. In this episode, we examine the question of how to be your best self. We do that by examining mental health and well-being issues and how this applies to people's daily lives. For those people who have yet to see any of our previous podcasts, I'd like to introduce my co-presenter, Ian. Ian is a senior accredited National Counselling and Psychotherapy Society member and the founder of Hope Therapy and Counselling Services. A warm welcome to you, Ian.
Thank you, Wendy. And to introduce you, you're a highly experienced CBT psychotherapist in private practice, been involved in the field of mental health and well-being for well over 30 years now. So following on from our episode on women's mental health entitled Can Women Really Have It All? Today, we're going to be discussing men's mental health and some of the stigma that often still exists around that subject.
Yes, Ian, and a very good subject to talk about. So, could you please explain issues around men's mental health and why do you think it's so important to focus on this?
Yeah, a really good question. So, clearly, everybody's mental health is important, but there are so many things about men's mental health that we need to just bear in mind. Um, so, first of all, surrounding the rates of mental health. So, studies have shown that women are more likely to reach out for help, more likely to get a diagnosis and subsequently to receive appropriate treatment for common mental health disorders such as anxiety or depression, whereas men are less likely to seek help when they need it, which can often result in an underreporting of untreated conditions. Men are more likely to engage in things like substance misuse as a coping mechanism for untreated mental health issues. And substance abuse can both mask and exacerbate the underlying mental health condition that a man might be struggling with.
Mhm.
We also know that men are at a higher risk from suicide compared to women. In many countries, men are 3 to 4 times more likely to die by suicide, indicating that there is severe, untreated, and often unacknowledged mental health problems for some men. And if we look at England specifically, men are significantly more likely to die by suicide than women. According to the Office of National Statistics, the suicide rate for men is about 3 times as high than it is for women. So if we look at 2021, suicide rate for men was about 15.8 per 100,000 of the population. For women, it was about 5.5. So while women in England report higher rates of diagnosed mental health conditions, men are more likely to get caught up in substance misuse as a means of self-medication, and they're also experiencing higher rates of suicidality than women as well. So the numbers really do indicate that men really do need to be involved in the mental health process and discussion at a much earlier stage, and to feel able to have those sorts of mental health discussions that stereotypically women find themselves more able to have than certain men out there.
Mhm. Okay. So really interesting stats there, Ian, and quite concerning, obviously, very stark. Those numbers are very stark, aren't they? So could you tell us a little bit more about the sort of things that men are more likely to need support with?
Yeah, so men can need help with anything, just like anyone else. But the two things that really shine out, maybe depression and anxiety. They're really big areas of significance. So if we look at depression first, again, looking at the Office of National Statistics in 2022, about 14% of men reported some form of depression. And if we look at anxiety disorders, estimates show that as many as about 1 in 5, so 19-20% of men will suffer from an anxiety disorder at some point. So, really significant numbers, but men really can need support with absolutely anything. So, maybe that they experience relationship challenges or bereavement. Maybe they're, as we mentioned earlier, maybe there are issues around substance misuse, PTSD, OCD, along with many, many other things. So the message really is that if you need help, it's okay to ask for it. And there is help available.
Okay. So again, very interesting numbers there, Ian. So what you did say that if people feel they do need help, they should ask for it. But what sort of signs might they notice? What do you think men should be looking out for?
Yeah, so if we take the type of things we might notice with anxiety and depression, the two things that we talked about just now, we might be seeing things. So, taking anxiety first, we might be seeing things like excessive worrying, that feeling of tense, of being apprehensive, being on edge most of the time, even when there's no apparent reason to feel that way. We might notice our thoughts are just racing, so we have difficulty concentrating or staying focused on things. We may notice an increase in irritability, or there may be muscle tension that we're not used to feeling. So a tightness of or a tension in the muscles, particularly in the neck and the shoulders and the jaw sorts of areas. Just a feeling of restlessness, of fatigue. We might notice gastrointestinal issues, so stomach discomfort, nausea, diarrhea, those types of things. A feeling of dread, of rapid heartbeat, and difficulty relaxing, difficulty coping. Those are the types of things that we might typically notice if we're struggling with anxiety. In the case of depression, there's things like a sort of persistent sadness, a sense of just feeling empty for much of the day, a loss of interest or a loss of pleasure in things that maybe we once found interesting or pleasurable. Maybe we're noticing a sense of hopelessness, or again, a difficulty in concentrating, or when we are thinking, there's sort of a negative bias to the way in which we're thinking. And again, we may notice fatigue or lack of energy, changes in appetite, either eating more or eating less. And again, we might notice changes in our sleep patterns as well. So none of those things have a diagnosis, but they are signs that it might be time just to reach out and to try to get some support.
Okay, thank you for that. That's really interesting. The type of symptoms to look out for that for men to be clear about. So why do you think it is that men are less likely to reach out for support, Ian?
Yeah, I think there's lots of things that we may need to consider, and the one is this sort of traditional masculinity that we often associate with men. So often there are societal expectations that start to come into play, often promoting an image of men as stoic, as self-reliant, as unemotional, and admitting that we may be struggling with mental health struggles can be perceived by some men as a sign of weakness, as a sign of vulnerability, and that just contradicts those norms that maybe we're brought up experiencing. So even in childhood, boys are often encouraged not to cry, whereas it can be more acceptable for girls to do so. I think there's also a thing around stigma. So men may fear being judged, they may fear being ridiculed for seeking help, which can deter them for accessing the support that is available for them. And if we consider the male stereotype of men not discussing the subject of mental health for whatever reason, whether that's stigma or for some other reason, we can also see that some men, because they aren't used to discussing the subject, simply may not recognize some of the symptoms of mental health issues. Or maybe some of the symptoms may be attributed to physical issues rather than emotional or psychological issues. And again, if we use that sort of analogy of good boys don't cry, we can see that some men are conditioned to solve problems independently and may just feel uncomfortable, maybe feel ashamed to ask for that help. They start to see it as a sign of weakness. And as a result of all of that, some men will simply have less emotional literacy than women, and as a result, will have less comfort in articulating their emotions and their mental health struggles. And the other thing is, as I said earlier, men are more likely to engage in things like substance misuse as a means of supporting themselves rather than reaching out for help as well. So there's lots of different things that play into that, I think, Mandy.
Mm. Thank you, Ian. That's so fascinating and very insightful of you to identify those issues. So, my next question is, I'm wondering, how do we make it easier for men to reach out for support?
Yeah, a really good question. And I think a societal question. So there's several key areas to consider, including cultural norms, including education, including accessibility, and the creation of supportive environments. So one area is the promotion of positive role models, and several key male role models have been very open about mental health challenges, which can be incredibly helpful in just normalizing the discussion. So we've had people like Prince Harry, he's been very vocal about his struggles with mental health, particularly following the death of his mother, Princess Diana. He's discussed his experiences with grief, with anxiety, and also the fact that he engaged with therapy as a result of those things. We can take people like the actor and the former professional wrestler, Dwayne The Rock Johnson, and he's spoken very openly about his battles with depression, particularly during his youth and the early parts of his career. And then you've got people like Ryan Reynolds, the sportsman Michael Phelps, the pop star Zayn Malik, and then people like Stephen Fry, the wonderful comedian, who've all talked about mental health challenges. So it's wonderful that that we're beginning to have male role models that are happy to speak out about mental health and to speak out about therapy. It just makes it part of the regular day-to-day dialogue amongst men. It really does help to just enable people to feel that it's okay to talk about these things. We also need to think about improving the emotional literacy of some men. Um, and there are various places that we can think about when we talk about that. So we need to think about fully integrating emotional literacy into education systems. So teaching boys how to recognize and how to understand and how to express their emotions from a very young age. Mental health training can also be offered in workplace settings as well, to educate employees and managers about mental health, reducing stigma, and promoting supportive practices. So there are several really large, high profile organizations like Google, like Microsoft, like Apple, that very openly spend large sums of money in supporting mental health. So some companies could maybe be a little bit more proactive in just considering the type of support that they're able to offer. And we did a previous podcast, Wendy, on this area, discussing how employers can create a supportive work environment. And that includes mental health days, employee assistance programs, and training managers just to notice and to be able to support deteriorations in employee mental health. So there's lots of things that we can do.
Mm. Yes, there's some really good ideas there, Ian, and thank you so much for all that information. So my next question is, let's say that a man does reach out for mental health support because of, say, a relationship challenge or maybe stress at work. What sort of help can they expect to receive? What's available for men out there? Can you tell us a little bit more about that?
Yeah, so there are there are various ways in which we can go about reaching out for help. Um, Confidential ways of doing this. Um, and so let's start by just talking about the NHS and the services that we may be able to get support with through that. So men may be able to access mental health support through their GP, who may be able to provide assessments and referrals or referrals to specialists in some cases. So they may also be able to prescribe medication for certain things as well. So a conversation with a GP might be a possibility for some people. They're often able to offer psychological therapies such as cognitive behavioral therapy, counselling, psychotherapy, through services like improving access to psychological therapists, which is often referred to as IAPTs. And for more severe instances, there are crisis teams available through the NHS as well. So having conversations with the NHS, starting with your doctor, can be a useful first step for some people. There are also organisations like the Samaritans who are accessible 24 hours a day, 365 days a year. They're available for anybody that's in distress. It's not just there for people that are feeling suicidal. Men can also access private counselling and therapy services like Hope Therapy and yourself, Wendy. Um, any man or woman can reach out to private therapists and discuss their needs in a really confidential way. So there are various offerings there, both NHS and private options as well.
Okay, thank you for that. Um, Could you perhaps explain why someone might seek private mental health support instead of the NHS and what the differences might be?
Yeah, so they are very different offerings depending on what you're looking for. So the advantage of the NHS is counselling and therapeutic support is free at the point of service. You won't have to pay if you access a counsellor through your doctor, and they can offer evidence-based and specialist services supporting mental health. So there are there are other good things about them as well, but those are two of the things that often get quoted as being advantages of going through that sort of NHS route. The disadvantages might be not all GPs will be able to offer you exactly the support that you might like. If they do, you are likely to be waiting longer. There's likely to be a waiting list to work with a private counsellor or therapist. You won't get very much in terms of choice, in terms of exactly who you work with, and there might be some limitation around the quantity of sessions that you're able to access. So, so working with a private counsellor, on the other hand, is a little different. So the waiting list is likely to be far, far shorter. Often you can find somebody to start working with, certainly within weeks, often within days. You will have more choice in terms of the counsellor that you work with. So picking somebody that you want to work with. So you can literally pick who you want and then just approach them directly. And then treatment plans can be tailored to your needs, and there's a high degree of flexibility around the number of sessions that you want as well. So counselling and therapy can go on for as long or as short a period of time as you want it to. But of course, there is a cost associated with private counselling that's absent via the NHS. So it's really worth just considering what your needs are, what you're looking for. But those are the sort of primary options that are out there.
Okay, thank you, Ian. That's again very, very interesting. Thank you for that. So I'm just wondering if a man has decided to access support and therefore approach a private counsellor or wants to discuss things further, what should he do?
Yeah, so organisations such as Hope Therapy and Counselling Services regularly work with men who are struggling with a wide variety of mental health challenges, as well as relationship challenges, work-based challenges. We also offer counselling to whole organisations as well as just individuals. So if organisations want to discuss how they can better support the mental health of their employees, men and women. Very happy to have those conversations with people. Um, People are able to contact us via the website, which is www.hopefulmind.co.uk. We have a whole variety of free resources up on the website, and we also have a counselling team that supports the entire UK as well. So again, that's www.hopefulminds.co.uk. And then, of course, you too, Wendy, a hugely, hugely experienced CBT psychotherapist, worked with numerous clients over the years, men and women. So maybe you can just talk a little bit about that side of things as well.
Yes, people can contact me. I work with both men and women and young people as well. So my website is called wendycastellino.com. And I also work with people who've got insurance. So people who are with AXA or Bupa or Aviva. So you can actually get payment for the therapy as well. So that's another sort of service that I offer. So Ian, thank you so much for those very interesting points about men's mental health, and hopefully it really resonates with a lot of our listeners out there who are men. And thank you so much for your podcast, and thank you for everyone who's listening, and we look forward to hearing from you soon. You take good care, everyone, and see you in our next podcast.
Thank you, Wendy, and thank you to everybody for listening. Bye bye.
Thank you. Bye.